Girl, we got some tea?
With the honey and the sugar.
Nah, we gonna need some wine for this one.
Well,
wine me, please.
What's up, everybody? Welcome back to the Wine Me Please podcast. Today you have Candace and Dominique. Shaniqua ain't here. She is here, y'all. She behind the scenes, but she here. She's here in spirit, and she's behind the scenes. But y'all just have to enjoy us for today. But not just us. We got a doctor here.
Yes. We have our special guest, Dr. Wanda.
Black
Give it up.
excellence.
Thank you for inviting me.
We are excited to have you here. So we hope you enjoy our little wine tasting. Tell us about it.
Absolutely. So we switched it up a little bit. Don't be mad. This ain't got no alcohol in it, but it tastes like it. So the reason that we're doing this is because we want to have something for everybody, including people that don't drink, but also moms that may want to have a drink every now and then, but you can't have alcohol. Free. I think it's free. Or it may be free, but it's F-R-E. This is a non-alcoholic wine. It is deep ruby in red, with red in color. All alcohol is removed. Okay? The red blend opens with ripe black cherry aromas. The palate is rich and smooth with bright fruit flavors, framed by a subtle smoky character and a lingering finish. Okay? Let's see, what else do we have here? 13% juice, less than 0.5 alcohol. Okay? It pairs well with grilled salmon, roast chicken, mushroom risotto. Try something different in your life if you ain't had no risotto. Okay? And tomato-based pastas and glazed ham. Now we're going to move on to Candace so she can tell y'all about the charcuterie boards.
So our charcuterie, we have some summer sausage, beef, no pork. We have some tomato basil cheddar cheese and a rosemary olive crackers. We usually don't tell y'all the details of the cracker, but we threw that in there for y'all. So yes, it has a rosemary flavor seasoning on there. So we can go ahead and get started. I pour us out. So yes, go ahead if we want to pass this to Dominique for me.
The middle.
No, the middle one. Okay.
You're trying to give me pork.
I'm okay with the pork.
Thank you very much.
There you go.
All right.
All right, swirl it around and cheers.
You guys, even if you smell it, it even smells like regular wine. This ain't no Stella Rosa. Okay? It even smells like
Really
actual
does.
wine.
It's convincing so far.
All right.
Cheers, ladies. Cheers. Look, oh, she's just gonna just.
My bad.
She ready. I like that.
It can pass.
It could pass. It's nice and sweet too, but it's not like overbearingly sweet. It has a nice subtle sweet.
It doesn't
It
give
tastes like
welchers.
it had alcohol in it.
That was removed.
It's like it had alcohol in it. Okay.
It was removed, so it started in okay. All right, the remix. I like that.
It's right here.
All right.
Let me try
Can
to
I try the cheese?
Yes.
I already started.
I'm only gonna take a little bit because y'all know I'm lactose.
Oh no.
You know, I know. I'll be suffering for y'all.
Oh, this is good. These little sausages are really good.
I believe she got the sausage from Aldi. We'll drop it in the comments where we got everything from, but that is really good.
Yeah, I'm here for that.
All right,
Let me take another bite.
so let's get in.
Okay.
So Dr. Wanda, we are super privileged. Oh, excuse me, I should have kept chewing. Privileged to have you here.
Oh. Thank you. I'm privileged to be here.
Yes, one is another successful Black woman. Two, also being a mother. I want to acknowledge both ladies are mothers, and we are in our Women's Health Month. So I want to acknowledge our ladies here, but also the expertise of her being a pediatrician. yes, she sees children, but you see families. And I feel like looking at families at a bigger picture you're not just treating the child, you're treating the family in a sense. And so we wanted to talk a little bit more about that, your perspective as a mother, as a doctor, and what you've seen in the health field as a doctor and as a Black woman.
So you can't treat a child without treating the family. You're absolutely right. I say majority of my job is dealing with the parents. Yes, you have to treat the child, but everything goes by way of the parents. So you not only have to please the child, but you please the parent. You have to make sure you communicate the information not just to one person, but to each parent as well. And so it is a family approach when it comes to taking care of kids. But I mean, as a mom, it's different, right? So as a pediatrician, you have this wealth of knowledge where you're just like, oh, okay, you can bring anything to me. I know how to treat it. I know how to figure it out. But somehow when you become a mom, it feels like all of that just goes out of the window. It could be the simplest thing. Oh, my child got a cut, or, bang their head. And you forget everything that you learned as a doctor or that you know as a doctor. And your emotions kind of take over. And you're just like, okay, what do I do? What do I do? So I find myself kind of, balancing the two, trying to figure out how to incorporate what I know as a pediatrician into being a mom, even though a lot of times the emotions kind of take over when you're doing your mom duties, right? Yep. But yeah, so it's a balance. It's definitely a balance. But as a pediatrician, I see kids from birth all the way till 21, to when they're on their way to college. So, everything from the regular old school checkup, getting some shots, to I got an ear infection, I got a rash or something that needs to be checked out. So, we do it all.
That's amazing. I think people forget about that fact that you can see them up until their young adulthood too. Because
when you get to college, then you start talking about adult issues. So now you probably need to see an adult doctor. But if you're coming home for your school physicals, that's fine.
I didn't even realize that until I took my baby to his first doctor's appointment, and it was 2 adults there, and I was like, "So where they baby?" I was like, where is the baby?
Yeah.
Y'all just let the baby back there by themselves. And then they called his name. I said, oh, you the baby. He was like 20, like 2021. I was like, oh.
But I think that has something I think that speaks to access, or not even access, but just like the continuous healthcare system, right? Of like we probably always switched doctors growing up where we didn't realize like, oh, we could have kept the same doctor because we had to jump in different providers versus someone having the same pediatrician their whole childhood.
And it also has to do with the needs at particular ages. And so you associate going to the doctor with baby shots, right?
Right.
You coming in every 3 months, every couple of months, getting shots and shots as a baby. And so that's what majority of what we see. But when you become a teenager, now you're coming in every year, right? Maybe you don't have as many issues or any issues. So you miss a yearly appointment. You come in every 2 years. You don't really need anything. So as kids get older into those teenage years, we don't see them as often. Because first, they don't think they need to come in as often because they don't need shots. You get your shots all the way up until kindergarten. You get your kindergarten shots. Then you get your 11 to 12-year-old shots. You get your 16, your 18, and that's it, right?
Yeah. And for young women, they, at some ages, start seeing a gynecologist, between like the ages of 16 sometimes. So they usually
sometimes sooner.
Yeah, so that becomes their primary care, not their pediatrician at that time, too. So,
so it also just depends on the need at that point. But yes, teenagers, we definitely see teenagers. Definitely.
So how has your experience as a new mom been with the dynamic of entering the healthcare and now you're an advocate for your baby because I know you have to be his voice. So how's that experience been for you?
It's been really good. Like I would hear like so many horror stories. Luckily I did get to experience that down to like my birth was even seamless. I'm a first time mom, first time pregnancy, and my labor was only 4 hours. My labor and delivery was only 4 hours.
That's great.
Yeah, and my baby came so fast I was screaming for epidural. That baby came so fast I couldn't even get one. But yeah, so everything was good. I was actually getting induced by I was about to get induced by my midwife who is Black. And we were planning for my induction to be that Saturday. I didn't want to get induced at all, but if we planned it for that Saturday, then she was like, I can deliver the baby, which I was looking forward to, but my little one came that Friday. So he was like, no, I don't want to get induced. So
I got it covered, don't worry.
Exactly. So that was that was really good. My prenatal care was really good, as I had mentioned before. So I went to UIC, University of Illinois Chicago Hospital, and when I had told them, I called once I found out I was pregnant to have my first appointment. And the lady that I was speaking to, she was like, "Do you mind if we contact you about a study?" Melanated group moms was a study that they were doing. So they were trying to see if minority women, primarily black women, receive better care with a full black team instead of having just a non-black team.
Yeah.
So I had a social worker that was black, my midwife was black, my nurse was black. They have what's called a resource navigator. She was black. My entire team was black. Once a month, I met with my midwife, and then it was a group of us, a group of black moms.
Yeah.
And then once a month, we all met together.
Oh, that's beautiful. So you have a community.
We had
too.
a community, and all of us to do at the same time, like literally weeks apart. Like once one into labor, we all would just start. It was like a domino effect. We
a cohort.
Exactly. So it provided us with support. We got to communicate with each other. We still talk to this day. All our babies are the same age. So it was a very, 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 very good experience. So I would like if someone, and we got paid.
Okay. Research. Okay. Yes.
Yes. So it was really good.
Beneficial research.
Exactly. I would definitely recommend if someone is around UIC, it's a study that goes on. It's an ongoing study. She's been doing it since 2010.
Do you know if it's just in Illinois, or do you know if they're doing these studies in different states?
I think it's honestly wherever she practices. Okay. So I have to get her information.
It's a study.
Yeah, so it's wherever she's practicing. Gotcha. So it's her baby. Katie Stewart is the midwife's name.
That's amazing.
It's her baby, and it was really good. So I have absolutely no complaints from the hospital. Like, even though once I had the baby, whoever was there was my care, right? Because he went into I went into labor. Like, people got lives,
right.
But even at the hospital, it was really good. Like I was nursing for a while, but when I first started nursing, it was really, really hard. TMI for some people. I'm just about to tell y'all what's going on.
This is about women's health. Okay.
But when I was nursing, I was having a hard time, like nursing, or breastfeeding. So they had 24/7 lactation support.
Oh, that's amazing.
So this while you were in the hospital?
While I was in the hospital, yep. So while I had called one of the ladies, and I was like, I can't get any milk out. Yeah. That lady came to my bed and had one hand right here on my boob and was pushing the milk out for me because I didn't know how to do it. I didn't know what ducts to massage, but she was literally just pushing the milk out for me. Like it was really good. And then the lactation specialist would contact me like once a month to check in on how I was breastfeeding.
That's amazing.
It was good.
So that brings up really, really good topic when it comes to care in the prenatal, in the pregnancy, and even afterwards, is the idea of centering. And so that concept is not new. I've seen that in different clinics where they have moms of the same gestational age. They go through their visits. They create this community together. But to center it and to have it based on ethnicity or melanated group is what's unique.
Yeah.
And we all know that better outcomes happen when you have culturally competent care. So that means people that understand you, that look like you, that are taking care of you, you get better care. And then we all know that Black women have the worst outcomes when it comes to pregnancy and giving birth. So that's really, really good. And then to have that support during your birthing process and even afterwards with breastfeeding, because again, we all know that Black moms do not breastfeed. Like, there's a lot of stigma in the Black community when it comes to breastfeeding.
Right.
I got 3 kids, and that first one was completely different than my other 2. Like, when I had my first kid, it was my mom's first grandchild. Moms are, grandmoms are like the matriarch. I know what to do.
And they're going
to feed that baby them greens and cornbread. Child,
exactly.
That teeth. Just chew that food up and give it to them. All of those little things that they say. And I remember when I first started breastfeeding, because I was in med school when I had my first daughter. And I wanted to
impressive. I'm just going to throw that out there. I'm just going to throw that out there.
I didn't plan it that way. Let's say that.
I know.
I wanted to breastfeed. And so I was like, okay, we're going to do it. We're going to get into it. And like yourself, I was challenged.
Mm-hmm.
My breast didn't want to act right. It, like you said, too much TMI. I remember when I first had her, went for my first visit for the baby, right?
Mm-hmm.
In 2 days, you go in for the baby.
Mm-hmm.
Nobody checks on you until
Yeah.
6 weeks.
Yeah.
It's kind of crazy.
Yeah.
But I went into the 2-day appointment, and I'm talking to the pediatrician, and I'm like this. Barely moved. And she looking at me, and I'm like, I can't get no milk out. At that point, around day 3 or so, your breasts get really engorged.
Yeah. Oh.
Yeah.
You
It's painful. I hear
make
it's painful.
all that milk, right? And so you really need some way to express it, whether it's a pump, a hand pump, or a baby. My baby wasn't taking out anything.
Mm-hmm.
And I was sitting there uncomfortable with these big old watermelons on my chest. And it was just like, okay, what do I do? So the lactation specialist came in, the pediatrician had access, brought her in, she taught me how to breastfeed, got me a pump for home, like all of this stuff. But I was just like, why are my nipples going with breastfeeding?
Mm-hmm.
It was one of those things where nobody had ever told
Educate.
me that when you're breastfeeding, and this may be too much TMI, but women of color, you start to get darker as you're pregnant, right? And so the idea is once you're not having a baby, your color just goes back to normal. But for some reason, the skin started coming off with the color. And every time I breastfed, it felt like a piece of my skin was leaving with the breast, with the sucking. And I was just like, this is too painful.
Yeah.
I breastfed for about 4 weeks and couldn't do any longer.
I did
because it
3
was
months.
just too
That was it.
painful. And I was like, no.
Yeah.
But my experience with my other two, so then I had 2 more kids about 10 years afterwards, after I was done with med school, residency and all that, and was a full-fledged attending and had more control over how long and what I could do. That one was smooth sailing.
Yeah.
You know, it was one of those things where I had control, I had all the resources I needed, and I was able to breastfeed for a year.
Kid
afterwards, yeah.
Did you exclusively breastfeed, or did you pump as well?
No, yeah, I pumped.
Okay.
So I'm one of those people where I was like a cow. Even with my first baby, as soon as I started pumping, we had an outside garage refrigerator
For milk.
full of milk. I mean, full of milk. And with the second one, I had gotten so much milk, and then our oldest had left the fridge open one night.
And for those that don't know, when milk is frozen, when breast milk, when it is expressed, it can last for, expressed meaning when it's pumped, when it's refrigerated, immediately refrigerated, it can last for 4 days, okay? When it is frozen and unthawed, it can only last up to like an hour or 2 or 24 hours.
I don't even remember.
It's less than a day.
But listen, that fridge was open all night for 8 hours, and that milk unthawed.
And it was warm probably at that time.
It was warm. It was in the garage.
You got to throw it away.
And so I went in and I was like, oh my God. I literally shed tears.
I was going to say, you can't get that. You can't get that
don't
back.
cry over spilled milk. Oh, you don't cry over breast milk.
Exactly. Because it takes so much
time and effort to get it.
It is everything, right? It is the nourishment to your baby. It is everything to your. It is what you literally are giving of yourself to your child, and then to see it just.
It's a lot of time. It's a lot of time. Randomly, I also, because you mentioned aftercare. So with the study, also we had a free postpartum doula for a year. So I have a who's also a Black registered nurse.
That's why I wanted to circle back to what you mentioned about the 6 week after appointment and the lack of follow up with women, Black women specifically in healthcare after pregnancy. What was the aftercare like? As people checking in on your mental health, because I think people under discuss postpartum depression. Postpartum psychosis isn't even in the DSM while we talking about it, but
postpartum preeclampsia people forget about too. You could go have a stroke after you have a baby.
So these things, how much conversation and education is around that in those spaces?
In the OB-GYN world, I can't really speak for that, but I do know that it is that 6 week postpartum appointment. But in the pediatrics world, because we know that we're usually at first touch point of the healthcare system for parents after they leave the hospital and baby, we do what's called an Edinburgh depression screening.
Okay.
And so for all the parents that come in, whether it's a mom or a dad, we give them a sheet that just talks about how they're feeling. You know, am I feeling depressed? Am I feeling sad? Just to see where they are in that journey. And if it's positive, then we try our best to get them to resources, have them contact their OB, maybe do a different assessment with their PCP, start medication. And so on the pediatric side, we are fully cognizant of the hormonal and mood changes that occur with having a child, and we try our best to catch it, right? And then we try our best to be that resource. And so as a pediatrician, we have social workers, we have lactation specialists, we have pretty much anything you need to try to get you in a good fit where you can be a best parent for the baby, right? So, I mean, that is, but overall, I think the healthcare in general, when it comes to maternal healthcare, is kind of dismal. When you look at other developed nations like ourselves, we don't have a universal maternity leave, which is just crazy. So I had our first child here in Illinois. As I said, I was a medical student. I didn't have any real insurance. I had like the school insurance.
Yeah, and that ain't
maternity leave. What is that? I mean, I'm in school.
You don't get a break.
Clerkships start every 8 weeks. So I mean, I've left the cycle. I literally started back clerkships 4 weeks after I gave birth to my first child, and that was after a C-section. Man,
oh goodness.
I couldn't barely walk, but I was like, listen, y'all not gonna have me miss this 4 weeks.
The things black women put themselves through.
I was like, no. I'm trying to be on the schedule. Even though I didn't know what was coming as far as the challenges of having a child and being in school, I started back 4 weeks after giving birth to her. And I was like, listen, we're going to keep this moving. That is what a lot of parents have to do here in the U.S. because there's no support system around recovery, around what you need after giving birth. But granted, I had my other two in New York. New York has a paid maternity leave and paternity leave. 6 weeks. 12 weeks.
Yeah,
that's good.
12 weeks. They give you about 67% of the top median pay in that state. Ooh. I took all 12 of them weeks with both of the two that I had because at that point it was like, are you sacrificing your mental health and your bodily health? Because I had C-sections with all the kids. And each C-section gets worse. Right, so
before at one point,
especially recovery, right?
After that third C-section, I was like, this can't happen no more. Yeah. This is a lot more challenging. And so I took 12 weeks. But it really depends on your state, which is just ridiculous. We should have nationally, you have time to recover, you have time to take care of your child, you have time to get everything together. Because we haven't even talked about childcare and how much childcare costs.
I was just going to piggyback just a little bit on a few things that you mentioned. One was about my experience with, because when I did my 6 week with my child, we did the Edinburgh depression screening. Had I not known that my provider was Black, I probably would have been as honest on the screening.
I was just thinking about that too.
So having a Black provider made me feel more comfortable to discuss because there are some cultural things that may lead to depression that she could understand a little bit better than somebody else could, or someone of another race. And then also the 12 weeks. So government jobs. I work for Cook County Health, so we got 12 weeks full paid. And then my husband, he's a Chicago firefighter. He also gets 12 weeks fully paid, but he's doing intermittent because he don't like staying at home. He's like, I gotta be outside, I gotta do something. So the 2 days a week that I go into work, he actually stays home for the baby. So, and then my mom is gonna help out too, so I can at least do a year without childcare because that's expensive.
Yes.
But a lot of people do forget about that. 12 weeks off isn't even enough because it takes more than a year for your body to heal from a C-section internally. Yes. My doctor told me that I will still be healing I feel fine after giving birth. But she was like, no, you're still going to be healing. Yes. She was like, it's going to be about a year before you just completely feel like yourself. So just to think that I'm supposed to jump up for those who only get 6 weeks, jump up and be myself after, honestly, birth can be a traumatic experience.
And I was going to say, postpartum can go up to 2 years.
Exactly. Birth could be something, even though my birth was easy, it was very scary at the same time. And then to have a C-section, they're cutting through 7 layers, 17 layers of skin. Yeah. That is a full-blown surgery. So a lot of people just misunderstand maternal health, child. It's just, It's something that we can have another episode about.
Yes. I think we should have Dr. Wanda come back and have another conversation and bless us again with your experience, your knowledge. I think we had a really fruitful conversation. Again, I think we could hit on so much more. But I hope you guys take our nuggets of information. You have anything to close, Dr. Wanda, Dominique?
Yeah, sure.
I mean, my thing is just take care of yourself, right? One of the things about becoming a parent is you start to realize that, you want your child to be his best. You do your child's hair, you get them the newest clothes, the best gym shoes, you make sure, but then you're walking around with the same bra you done had on for 15 years, right? Or holy underwear, right? We're not taking care of ourselves. And I think that's one thing that we need to emphasize more is that when you become a parent, you not only take care of your child, but you take care of yourself. So don't feel guilty. Don't feel bad for taking yourself on a shopping spree, for having a glass of alcohol-free wine, taking a moment and doing a podcast. Like, enjoy your life. You're not just a parent. You're taking care of your child, but you're also taking care of yourself. So, yes.
Thank you so much for the gems that was dropped, okay?
So...
Yes.
We're going to close us out, girl.
Yes, as you know, we're not the podcast for tea, so wine me, please.
All right.
And don't forget, if you want our advice, send us an email to advice@winemepleasepodcast.com.